Magandang araw po sa ating lahat. We are back with our rationalization, and what we're going to talk this time is all about cardiovascular disorders. Okay? Care of clients with cardiovascular disorders. So wag na nating patagalin, let's start. While a pacemaker catheter is being inserted, the client's heart rate drops to 45. The nurse would expect the physician to order is A. Atropine sulfate, B. Digoxin, letter C. Lidocaine, and letter D. Procainamide. The correct answer here is atropine sulfate. Atropine sulfate blocks vagal stimulation, therefore, it increases the heart rate. We must remember that this is an anticholinergic drug. It blocks the acetylcholine's action. That is why it increases heart rate. Okay? How about the digoxin? This is not the answer because this drug is to increase the cardiac contractility and slows the heart rate and increases stroke volume. It does not increase heartbeat. Okay? How about the lidocaine? This is not the correct answer as well because it is a local anesthetic and antiarrhythmic drug and is not indicated to increase heart rate. Okay, lastly, procainamide, it is also an antiarrhythmic medication. Again, our answer here, the medication that increases the heartbeat is letter A, atropine sulfate. Okay, number 2. A client with myocardial infarction is receiving heparin. If the anticoagulant therapy is effective, the nurse would expect, again, a client with MI is receiving heparin. If the anticoagulant therapy is effective, the nurse would expect A. APTT twice the normal value, B. An absence of ecchymotic areas, letter C. A decreased viscosity of the blood, and letter D. A reduction of confusion and weakness. Ang tamang sagot po dito is letter A. The therapeutic effect of heparin is obtained when results of PTT or APTT are 2 to 2.5 times the normal value. Again, the therapeutic effect of heparin is obtained when results of PTT or APTT are 2 to 2.5 times the normal value. Okay? Paano kung tanungin din nila when to know if warfarin therapy is in the therapeutic level? Our answer should be prothrombin time is 1.5 to 2 times the normal value and an INR of 2 to 3. Okay? Let's go to number 3. When obtaining health history, the nurse should be aware that one of the subjective symptoms of primary hypertension is A. Mild but persistent depression, B. Transient temporary memory loss, letter C. Cardiac palpitations during periods of stress, and letter D. Occipital headache, particularly in the morning. The correct answer here is letter D. Hypertension is characterized by occipital headache, especially upon waking up in the morning. Ano daw po? Hypertension is characterized by occipital headache, especially waking up in the morning. Wag po natin kalilimutan, number 4. The client will undergo right-sided cardiac catheterization. Which of the following should not be included in patient teaching? A. You may have to fast for 6 to 8 hours before the procedure. B. You will experience warm or flashing sensation as the contrast medium is injected. Letter C. You will be transferred to the operating room and you will receive general anesthesia. And letter D. You have to tell me if you have allergy to seafoods. Ang hanapin natin dito is the patient teaching that is not to be included for cardiac catheterization. Our answer here is letter C. The client who will undergo cardiac catheterization will be transported to the cardiac catheterization laboratory, not in the OR. And he will receive local anesthesia and not general anesthesia. Hindi po general anesthesia, kundi local anesthesia. Huwag po natin kalilimutan. Ibig sabihin, yung letter A, letter B, and letter D are correct health teaching before cardiac catheterization. Okay? Yung letter A, you may have to fast for 6 to 8 hours before the procedure. Tama po yan. Yung letter B, you will experience warm or flashing sensation as the contrast medium is injected. Normal lang po yan. And yung letter D, you have to tell me if you have allergy to seafoods. Tama din po yan. So, ang mali lang na health teaching before cardiac catheterization is yung letter C. Okay? So, ang sagot natin is letter C. Let's go to number 5. The client who experiences angina has been told to follow a low cholesterol diet. Which of the following meals should the nurse tell the client would be best on her low cholesterol diet? Ang sagot po natin dito is letter C, spaghetti with tomato sauce, salad, and coffee. These are foods low in cholesterol diet. Obviously, yung mga ibang choices are foods high in cholesterol. Therefore, our answer here is letter C. Number 6. How should the nurse instruct the client with angina on the use of nitroglycerin when chest pain occurs? Again, how should the nurse instruct the client with angina on the use of nitroglycerin when chest pain occurs? Our answer here is letter C. Take 1 tablet, then additional tablet every 5 minutes for total of 3 tablets. and then call the physician if pain persists after 3 tablets. Okay? Nitroglycerin is indicated to relieve chest pain in angina pectoris. It is taken to a maximum of 3 tablets at 5-minute interval. Again, nitroglycerin is indicated to relieve chest pain in angina pectoris. It is taken to a maximum of 3 tablets at 5-minute interval. Okay, number 7. While caring for a client who has sustained an myocardial infarction, the nurse notes 6 premature ventricular contractions in 1 minute on the cardiac monitor. The client is receiving an intravenous infusion of 5% dextrose in water and oxygen at 2 liters per minute. The nurse's first course of action should be to A. Increase intravenous infusion rate. B. Notify the physician promptly. Letter C. Increase the oxygen concentration. And letter D. Administer the prescribed analgesic. The correct answer here is letter B. PVCs or premature ventricular contractions of 6 or more per minute is life-threatening. If uncontrolled, this may lead to ventricular fibrillation and cardiac arrest. Ano daw? PVCs or premature ventricular contractions of 6 or more per minute is life-threatening. Therefore, our answer here is letter B. Notify the physician promptly. Okay? Number 8. When ventricular fibrillation occurs in a coronary care unit, the first person reaching the client should A. Administer oxygen. B. Defibrillate the client. Letter C. Initiate cardiopulmonary resuscitation. And letter D. Administer sodium bicarbonate intravenously. The correct answer here is letter B. Ventricular fibrillation is a death-producing dysrhythmias, and once identified, it must be terminated immediately by defibrillation or precordial shock. This is usually a standing physician's order in a cardiac care unit. Again, kung merong ventricular fibrillation, kailangan ng immediate defibrillation or precordial shock. Our answer here is letter B. Number 9. When taking an admission history of a client with right ventricular heart failure, the nurse would expect the client to complain of? Pag nag-assess ka daw ng history ng client na may right ventricular heart failure, ano daw ang ine-expect ng nurse na complaint ng patient? Our answer here is letter A. Ascites, edema, and fatigue. Right ventricular heart failure is characterized by a daming backflow of blood in the venous circuit. Kaya nagkakaroon ng ascites, edema, and fatigue. Okay, number 10. In which of the following positions should the nurse place a client with suspected heart failure? Ano daw ang position ng client na suspected na may heart failure? The correct answer here is letter C. Sitting almost upright or high Fowler's position is the preferred position for the client with heart failure. This position reduces preload or venous return and improves lung expansion and oxygenation. Again, sa patient na may suspected na may heart failure, sitting almost upright or high Fowler's position is the preferred position. This reduces preload or venous return and improves lung expansion. Number 11. The client should teach the client that signs of digitalis toxicity include which of the following? A. Skin rash over the chest and back. Letter B. Increased appetite. C. Visual disturbances such as seeing yellow spots. And letter D. Elevated blood pressure. The correct answer here is letter C. Digitalis or digoxin toxicity manifestations include visual disturbances, yellow or green vision, blurred vision, and among elderly, halos or rainbows around the light may be experienced. Other signs and symptoms of digitalis toxicity include bradycardia, nausea and vomiting, anorexia, diarrhea, ventricular dysrhythmias, anti-androgenic effects in males like gynecomastia, and decreased libido and impotence. Again, our answer here is letter C. Visual disturbances such as seeing yellow spots is one of the symptoms of digitalis toxicity. Okay? Number 12. A male is diagnosed with hypertension and is started on a regimen of hydrochlorothiazide. The nurse should help him to understand that he, A, must adjust the medication according to his blood pressure. Letter B, may experience impotence because it is a usual side effect. And letter C, will probably require the medication for the remainder of his life. And letter D, should omit one dose if he experiences any manifestation of orthostatic hypotension. The correct answer here is letter C. Hypertension is a lifelong disease, therefore treatment will be for the remainder of his life. And treatment involves diet, exercise, and medications. Okay, our answer here is letter C. Number 13. Following vein ligation and stripping in a client with leg varicositis, the client would be positioned in. Pagkatapos daw ng ligation and stripping sa client na may varicositis, Ano daw ang position ng client? A. Supine with knee gutch flex. Letter B. Semi-Fowler's position with knees flex. Letter C. Supine with legs elevated at 30 degrees. And letter D. With the head elevated and the feet against a footboard. Our answer here is letter C. Elevation of legs at 30 degrees while the patient is in supine position promotes venous return, and this prevents edema of the legs. Again, our answer here is letter C. Supine with legs elevated at 30 degrees. I think this is our last item for now at maraming salamat po sa panonood, and I hope na meron po kayong natututunan, and you may leave comments down below kung meron kayong mga suggestions or yung mga gusto nyong topic na pwede nating talakayin. I will be very happy na gawan ng mga videos yung mga yun. Okay? So, and open din po for shout out for our next video para naman meron tayong interaction. Okay? Maraming salamat po ulit sa panonood. See you tomorrow.